Castle plans to transform the seat of Timber Hill Health Center into a restaurant when the contract finishes. As the only one walk-in center in Norwich, the health center is an important facility for people's lives. Rachel Capers-Barrow said the health center has saved their couple's life.
They helped. They saved my husband's life twice. They saved my life. I was diagnosed with sepsis last year, and they found out that I had a serious infection um, last year, which turned out to be sepsis. And they saved me um, by getting me to the hospital very quickly, which no, because no other surgery will take me on because of the conditions I've got and treatment I need, and my husband, the amount of tablets I'm on. So they're very good here.
What's your opinion about the health center would move out the Castle Mall?
I think it would be the wrong idea. I think it's situated in the right place, right central location for everyone to go to. If it moved out of the city centre, it could cost people money, bus fares. It's ideally here, it's the most practical place to be.
Donald Lost-Chapman, the manager of this health center, said there are nearly 16,500 patients a year.
For the walk-in patients, we see about 85,000 walk-ins a year. In total, there's about 120 to 130,000 people come through the centre. We've got over 8,000 patients registered.
And what impact would be made on them if the health center moved out the city center?
Well, if the practice moved out of the city centre, I think a lot of the patients would find it difficult to get to the health centre. And with the links that we have with the transport system in Norwich, I think a lot of the walk-in patients would find it very difficult. It's a walk-in centre, so it's important to have good public transport and good parking facilities available.
Castle indicate that they recognize the importance of this facility in Norwich. They would like to provide a seat near the pharmacies on level 2. Hundreds of thousands of people hope to keep this health center in the city center. City Councillor Simeon Jackson and MP Chloe Smith both take concern of this incident.
Infrared, who manage the Castle have submitted proposals before a consultation has really been completed with the health centre and with members of the public. And I would encourage them to halt any plans until they've come to a full resolution as to what's going to happen to the health centre.
I'm holding a meeting later this week which is to bring together the NHS authorities involved in this. The difficulty here is that it is a multi-party negotiation. So there's NHS England, who pay the bills on behalf of taxpayers. There's Norwich Practices Limited, which is the group of doctors who run the surgery. And there's also the landlord. So it's a multi-way situation. I don't think it's remotely healthy to be blaming anybody at this stage, but I want to instead bring people together around a table to discuss what can be done, and I'll be putting my constituents' views as strongly as I can.
Timber Hill Health Center opened it in 2009, which is the only one walk-in center in the city center of Norwich. However, it would be closed and moved to Norwich and Norfolk University Hospital if they can't stay in the Castle Mall after 2 years.